Welcome back. We're talking about how we can take better care of our health and the different services offered in the Triangle to help you in this journey. Joining me now is James Osborn, Director of Education and Outreach at Alliance Health. James, welcome to the show.
Thank you very much.
What is Alliance?
Alliance is your local management entity and managed care organization for public behavioral health. So we are managing the care of 471,000 Medicaid eligible and uninsured individuals in our counties, which would be Durham, Wake, Johnston, and Cumberland counties. So we're managing a network of providers. We're also managing the care and making sure people have quality care and that people can access and navigate systems.
So you don't actually provide the actual health service.
Correct.
You connect the parties, those that can provide and those that need the help.
Perfect. Yes, that's exactly right. And so we are that connector between the funding sources of Medicaid and the State Division of Mental Health and also the local county dollars, and contract with those providers to ensure that individuals have choice around care and that quality care is being delivered. You
know, behavioral health or mental health is one of those types of illnesses that a lot of people, I guess there's a bit of a stigma attached to it, but even beyond that, you know, you can see a broken arm and people understand that, but mental health, not so much. How has it been over the years that you've been associated with this organization? Have you seen a shift in how people perceive mental health? And how does the county overall look in regards to the folks that are suffering from this?
Stigma is a huge issue, and no one wants to admit that they have a problem. And by addressing some of the myths and misunderstandings that we have about behavioral health, which would include mental health, substance use, and also intellectual and developmental disabilities, when we start addressing those kind of issues, that can increase and improve people's ability to reach out and ask for help. So through doing programs like this, by joining health resource fairs like we have on March the 30th, by partnering with the health department and other key county stakeholders, we're able to work across systems to make sure that individuals don't fall through the cracks, and also so we can address the whole person. We need to address both physical, mental health as a whole individual.
Well, James, tell me, how is it that you can partner with 2,000 providers? How does that network come together?
Through the Medicaid reform process that has been happening in North Carolina starting around 2010, 2011, there were already many Medicaid providers in the network. And part of the reform process was closing the network so that we had a more concise number of providers that we're able to monitor more closely. In North Carolina, we have an issue with Medicaid fraud. And we need to make sure that people's taxpayer dollars are being appropriately used with the right providers, and that people are getting the services that have been promised to them, and that we also have outcomes. And so by having those 2,000 providers, it also ensures people have access to care that's close to your home, that's convenient. Also, individual choice is really important in someone's wellness. You want to be able to choose who you go to and choose that provider. And by having that diverse provider network, it allows us to do that, along with making sure it's close to your home and convenient to make your appointments.
Well, I understand that you're going through, not you personally,
sure,
but the Alliance is going through a bit of a transformation. What's going on?
Yeah, so we are changing our name from Alliance Behavioral Healthcare to simply Alliance Health. And that is consistent with the current transformation within the Medicaid program, as we are moving towards the standard plan and the tailored plan of Medicaid. So the tailored plan that we will be looking towards being a manager of is dealing with both the physical, mental health, and the pharmacy services. So it's a whole person approach. For many years, we've talked about integrated care. People want one-stop shop, similar to like Wake Human Services, where you can get public health and social services in one spot. We have to make it convenient. And in the same way with Medicaid, we want to make sure that we're dealing with all the person's care, and that we have continuity of care with a single care team that is addressing the physical, mental health, and the pharmacy services of an individual, so that we don't have a fragmented system that has created so many challenges for people.
Now, is that overall a better outcome for the patient? Because I've heard you really kind of stress the whole person versus the system that may have been in place before.
Absolutely. So we have, in the past, using a medical model, kind of either focused on the physical health or the mental health. What we actually need to be focusing on are the social determinants of health. For example, where a person lives in their zip code has a huge impact on how well they are. How close are they to accessible food, or are they in a food desert? How close are they to public transportation or other ways of getting to appointments? And poverty, food, shelter, clothing, those impacts how well somebody is able to follow through with the treatment they're receiving.
I know we have an opioid, for instance,
Absolutely.
epidemic.
Yeah.
Are you seeing that here in Wake County as well?
Absolutely.
All right.
So the Alliance for Action website, allianceforaction.org, is a campaign by Alliance Health to address the opioid epidemic and to make sure individuals, everybody knows that they can do something. We can do something to help individuals. And so there's information on the website geared both towards the individual, but also towards their families and also towards professionals, because we do have an epidemic and we want individuals to know, one, that they can please check your medicine cabinet at home. DHHS, the Division of Health and Human Services, has a Lock the Meds campaign going on statewide that people need to check their meds for, check their medicine cabinets for possible expired medications or other pain medicines that might be misused. We want people to know about Narcan and know that there's a nasal injected type of medication that can be used to reverse opioid epidemics or opioid overdoses. And we also want people to know what the signs and symptoms are around substance use disorders. Again, we want people to be able to see something and say something so that they're able to intervene, because everybody knows somebody. 1 in 12 individuals end up having a serious substance use issue every year. 1 in 5 people have a serious mental health, have some type of mental health condition going on. So everyone knows someone, and it's an opportunity for us, again, to deal with the stigma, to be able to reach out, to let people know we're concerned, and help navigate people towards the lots of community resources that are available.
That's awesome. And for the viewers who want to get in touch with you?
Sure. We have a 1-800 number, 1-800-510-9132. It's a 24/7 local call center that has people here in the Triangle that will be able to answer any questions that you have, make an appointment for you if you have Medicaid or you're uninsured, or if you need crisis services. We have local crisis centers available in communities where people can walk in and get the help that they need and get connected to a provider. We have mobile crisis teams. For the website, alliancehealthplan.org.
Awesome. James, awesome tie too.
Thank you
is
so
one
much.
Awesome tie. Thank you for being with us.
I appreciate it.
Now don't go away. When we return, we'll tell you about an upcoming health fair that will provide free health information, screenings, and a whole lot more. Stick around.